Good evening, everyone. We'll be kicking off in about 10 minutes. Feel free to start using the chat box. That should be a Q&A section at the top of your screen. Feel free to start sending some messages. We'll have people monitoring the chat the whole time and getting back to you as we can. Feel free to introduce yourselves. But yeah, we'll be starting in about 10 minutes, all right? Amazing. Good evening, everybody. I make it 6:30, so I'm going to kick off our session. From what I can see, we have about 160 people joining us this evening, so hello to all of you all. My name's Asia. I'm one of the PCN pharmacists for Ivor Valley South. Our PCN is our three main practices that we cover. So some of you will be from Shepherd surgery, some of you will be from Larksfield and Owlsley surgery, and some of you will be from Lower Spondon. So we cover those practices, we get shared out amongst you all, and there's lots of different roles here that we do. So first of all, I just want to say you should be able to see, assuming all of the technology is going well, you should be able to see a little agenda of who we have planned to speak this evening. So feel free to dip in and out of this evening's session as you wish to, because we appreciate that 2 hours is quite a long time to spend with all of us. And we all have lots of different things to be doing on a Monday evening, hey. So second of all, I'm hoping, look at that, it works. Just want to go through some housekeeping rules. So just first of all, make sure to be polite and respectful to everyone around you. Remember that there will be some difficult topics coming up. We're not going to go into any details or anything this evening, but if you do find anything difficult, feel free to leave and come back when you're feeling a bit better, but also just be mindful of the way that you're using that chat box there as well. So on the subject of the chat box, somewhere at the top of your Teams, you should have a Q&A section. It looks like there's two little speech bubbles. So if you click that, you'll be able to see the questions and answers box. Feel free to pop in any questions that you wish to. And if you don't feel comfortable sharing your name, that's absolutely fine. There is a function to post anonymously in there as well. Our whole team is working super duper hard behind the scenes, and they will be replying as they can between speaks and things like that. If there's anything sort of common coming up, any broad topics that we need to raise with any of our speakers, we'll definitely do that. So don't worry if you've got lots of questions coming up. The other thing I will say is that if you want to, we'll give out the information at the end of the session so that we can send all of the contact details for everybody that's spoken today. So if you have any specific questions, any very individual questions, especially about some of the services that we're going to talk about this evening, you can contact those teams directly. So on the subject of that, we try to avoid anything too personal, try and keep it nice and broad, because then everybody gets the right information. Last thing to say is just to enjoy yourself. You're here on a Monday evening, might as well make the most of it. Hey. So I'm going to go back to the agenda, and I'm going to kick off with just a little chat, and then, yeah, we'll kick off into our first speaker. So like I said, my name is Asia. I'm one of the PCN pharmacists. Some of you may have already spoken to me before for your medication reviews, probably spoken to one of my colleagues. I just wanted to sort of kick off and say that, you know, mental health is really difficult. Everybody has a mental health, and answers about mental health are really, really difficult to work out. They're not black and white answers, right? There's quite often a lot of shades of grey in between. And it quite often comes down to treating people in a kind of like an art form as opposed to a science form. It's not quite as straightforward as a flowchart where we go, okay, well, you feel this sad, so therefore we're going to prescribe this one thing. The other thing to remember is that everybody has a mental health. In the same way that we all have a physical body, we all have a mental health, and we should be looking after it all the time, not just when things get really difficult. And that's really difficult in itself because it's not something that we typically teach people. It's not something that we typically learn unless we're going out of our way to do that. So hopefully this evening you'll be able to pick up some ways, find some ways that you might want to try looking after your mental health or tackling it in a different way. Now, we live in an ever-demanding society, and those demands are just getting bigger and bigger each time we look at it. Hey, we don't need to talk about stuff like the cost of living crisis, because we all are probably struggling with that. Existing on its own is hard. Existing is really difficult. And, you know, stress is huge. It plays such a big part on your physical body. You should never underestimate the power of stress on your body. Things like social media and being in demand 24/7, it's still a really new concept to be accessible to people that you know 24/7 from your phone. So when do we actually create any time for ourselves to look after ourselves? How do we do that in a lifestyle where we're constantly having to do things and achieve things and be there for people? So how can our PCNs help? Well, I've talked a little bit about me, and of course, being a pharmacist, I can talk to you about the drugs and the medication and help you make the decision about whether that's the right choice for you. We can guide you through things like side effects, things like settling in on doses, because it can take time with medication. And we can help you make a really informed decision on whether that is the right decision for you. But outside of that, we've got loads of different people in our team. We have health coaches, who I'm not going to talk too much about because I've got lovely Diane speaking to us a little bit later about health coaches and the role of health coaches. But some of the folks that we've got working behind the scenes today, they're care coordinators, and they are absolutely fantastic at helping you, empowering you to be able to manage your own care yourself. It will be things like helping you get to appointments, transport, remembering when to go to appointments, staying on top of paperwork and chasing up referrals. But it will also be that kind of support that you might need, maybe just to speak to someone once a week and update them and have somebody oversee that care for you as well. They're incredible people, and they are a service that is very, very underutilized. But between us all, because we work so closely together and we all do different things and we all help you in different ways, we also all chat to each other as well. So quite often you might speak to your care coordinator and they might say, I'm going to book you in with the pharmacist. I think we maybe need to have a look at your medication. And just like that, you get booked in with your pharmacist and we'll have a chat about the medication. So you see how we look at you from different angles and we make sure you're supported from every way that you face. The main thing to remember that there's no single answer to the question of mental health. And indeed, there is no one size fits all answer for that question either. It's also not fair to say that there is one fix that will work for everybody. Otherwise, everybody with a mental health problem would be on medication and they would be having fantastic results from it. But in reality, that's just not what happens. It is a holistic process and it is an ongoing process. I think it's something that doesn't ever really stop. It's one of those things that you work at and you have to maintain in the same way that you have to do your food shop to make sure there's food in your house. You have to look after your mental health to make sure that you feel well in yourself. It's going to take a little bit of everything. I think medication is part of it, but so are things like exercise, diet, social, doing things that you love, things that are good for your soul. You are an individual person with your own perspective of the world and your own lived experiences. And everybody that you meet, everybody else in this call, me, my colleagues, we're all exactly the same. So the way that we approach things is going to be different. But it doesn't mean that any of those approaches aren't valid. It just means that we need to find the combination that is right specifically for you. And that's why it can be a little bit difficult, because it isn't as straightforward as following a flowchart. So for this evening, if you want my advice, if you're not sure why you're here, if you've logged on just to see what it's about, first of all, well done for taking a step to look after yourself, for taking the step to find some new information. I'm proud of you for doing that. I'm proud of you for logging in on a Monday evening to do some self-care. But the second thing is, just if there's one thing today that sounds good to you, maybe there's one tip, maybe there's one trick, maybe there's one service that you want to reach out to, and just focus in on that. See if you can do that when you leave this call, maybe in the next few days. Give it a go. If it doesn't work, totally fine. Do you know what? Eliminating an option is still really helpful. To know that something doesn't work is just as valid as knowing that something does work for you. And just because it doesn't work for you doesn't mean it's not going to work for the next person. The information that we're sharing with you today is going absolutely nowhere. We're going to make sure that you've got this information. So like I said, we will be sending it out to you. I'll find out the email address and I'll get that posted up in there as well. So then we can get your contact details and send you all the relevant information. It will be up as we go through the evening as well, but please don't worry, the information isn't going anywhere. So try to focus in maybe on one thing and see where you get. So that's kind of it from me. Like I said, have some fun with the Q&A session. This is the first time that we're doing a talk or we're doing anything this way, so please bear with us if there's any technical problems. I appreciate your patience. But hopefully if it works really well, we've got 200 people, hello all 200 of you. Perhaps we can do this again in future with something else. So with that, I'm going to pass over to Patrick, who is talking to us from the mental health team. Are you here, Patrick?
I am here, Asia. And welcome everyone. I'm sorry, I've had a cough for the last couple of weeks, and so I apologise if my voice is a bit croaky. Thank you ever so much for that, Asia. I really appreciate that. I'm going to share some slides that I have, which hopefully you can see. I think I now need to just press on slideshow and go. Excellent. Hi, I'm Patrick Moore. I'm the service manager for mental health services in Central Beds, and we are the providers of our community health teams within Central Beds. Our main one serving the Ivor Valley North area is Ivor Valley South area is our Biggleswade Community Mental Health Team, which is situated at Spring House in the grounds of Biggleswade Hospital. It's been around since the early 90s, following developments and changes in legislation at that time. There has been no real changes in how services have been delivered for about 35 years. So, but what's happened in that time is that there are more services have come on board and been developed, like our crisis teams and CAMHS service and perinatal services. But what's been happening is that we've really been operating as individual silos, and with some very severe gatekeeping, it's been really hard for people to access our services. So what's we've undergone in the last couple of years in mental health is what we call our transformation program, which hopefully, yeah, is that happening? Can people see that? Asia, can you tell me, can you see the second slide? I'm hoping you can see our second slide. Again, these will be available. I'll send them over to Asia and the team, and they can be picked up.
I don't know if you can hear me, Patrick. We can only see the first slide.
Oh, right. Okay, let me see what I can do.
I think Asia might have frozen. Yeah, that's it. Now we can see it. Thank you.
Okay, excellent. Thank you. So again, we had our a new document was published, our framework document in 2019. Again, following from the 10-year plan and the NHS 5-year mental health review plan as well, with some particular aims and objectives, and a real, and again, as you see here, real focus on what Asia had picked up on, this emphasis on community connection, quality of life. There are many aspects to trying to promote good mental health care, and it's not again all about medication and treatment, but actually if we can engage with the many resources that we have in our community, and again we'll have a really positive impact on people's health. Dissolving those boundaries between primary care and secondary care, very important. We've now got our primary care link workers again doing that join up work between our primary care and our secondary care. We've also got our mental health ARS workers in certain areas of Central Beds, which we're trying to promote further, who again will do much more preventative work in the surgeries. Really understanding as well that moving to that no referral culture, in terms of that there'll be no wrong front door, that when you again are wanting a particular help and service, you will be now that the referral will be made to the team, and it would be if it was for a particular other service related, like P2R, a drug and alcohol service, or crisis team, or eating disorder service, again the referral will be passed on appropriately to that, having to go back to the referrers. And it was also recognizing that mental health is provided as part of a system, of which, us as providers in health are an important part of that, but we are not the only providers of mental health services. They're provided by our primary care colleagues, they're provided by our voluntary sector organisations and peer support groups, and that's really important to realise that we don't do this again alone in isolation. So with that we've got these new partners who have again joined and are embedded within our services. So within our mental health service now, we've got community connectors from Mind, we've got health and wellbeing champions from BedsRCC. We've got again carers, the important role that carers play within our service as well. So we've got carers in Bedfordshire, as well as new roles, new clinical roles of more focus on the talking therapies with psychological treatments, and also a great new position of a community pharmacist in there, which has been a really positive acquisition, where somebody's relationship with again with trying to handle medication, can be very different with discussions with a pharmacist than possibly with a consultant, and again feels, people feedback to me, feels much more of a shared and collaborative process. And that's what we really want to do, is again through the Dialogue Plus assessment system that we have, we want people to be able to again to be focused on the areas that they wish to work on, the areas that they need support, and to be able to dictate really how they are treated and what will best work for them. I won't go through all the various boxes there. Again, this slide will be circulated. So we'll go on to my next one here. So these are the various roles that we have now within our mental health services, and which was meant that before, when referrals came in and they were just simply triaged by a doctor and possibly one other worker, and a much more narrow approach was taken of somebody you either continually assessed for something or you would just put an outpatient's appointment for one. There's now much more variety, a much more wider selection of services. So we're really looking at these triage meetings that occur every day of, again, trying to get the appropriate and correct intervention as soon as possible. Some of that intervention is really timely, and our mantra is very much that that right time, right person, right intervention, and getting there from as quickly as possible from the referral process. As well as I said, our partner organisations are also involved in this triage process as well, and we benefit so greatly from having their knowledge and experience. Other work we're doing is with people who are possibly have been open to our services. We know there's a real fear about that cliff edge discharge, that you go from receiving a lot of services and having that input to suddenly being told you're discharged and you feel on your own. This is where we see the great use of our community connectors, of engaging people in their local communities, but also working on people being able to re-access services should they need that help and assistance sometime in the future, without having to go through that cycle of going back through to the GP to have to re-refer, etc. And also we're wanting to do much more coordinated step down some services as well, so it feels safe and secure, and that support network still remains available to you. Some of the roles that we have there, again, have continued already, but again, all of these people are working together as one particular system. Okay, so this is again just a flow diagram. Quickly, we sort of came up with that request for support coming in, getting that first conversation with a professional, being able to book that particular assessment, doing our Dialogue Plus, which is again is very collaborative needs assessment done with people, or it could be a specialist mental health assessment if it's something either a Care Act assessment, maybe with somebody who has got care and support needs, or it could be an OT assessment or a particular psychological assessment. And again, being able to tap into all the various options open to us, from community resources, a PCN hub, and actually possibly more longer term specialist mental health services that again are also on offer. We're really keen to get feedback from our users. We have a very active people participation group, and also we have peer support workers working within the group, which has been really helpful in terms of sometimes when people have had not so great experiences being within mental health services and possibly find it difficult to have that relationship with clinicians. We found that people working with other people with lived experience has been a really positive forum for discussion, but also for being able to again engage in services in a way that best suits it. And that's been one of our really positive again innovations that we've brought in. Our clinics are based at we're in Spring House, but also our primary care link workers see people within their surgeries. We have our community connectors and our the health and wellbeing champions see people within the community at particular community centres or other identified places, and wherever it really would best suit that individual. We do work very closely with our recovery college, who have got some excellent services and courses that are on offer, and we can again be helping people to engage with that, and again we've had some really good feedback on that part. One of the things which has been great is to be able to come here and have this links with our primary care networks, and again part of the new ways in which we're all working of recognizing we are one system. These conversations probably wouldn't have happened a couple of years ago, but to build up those relationships with Asia and Danielle and their teams there has been again one of the real positive parts, and keeping that communication is really important across the system. I'm conscious there's a lot to be being said tonight, and so this is just a taster of what we're up to and doing at the CMHTs. My email address is there. Please feel free to again drop me a line or give me a call. Any particular queries, we're most willing to help. And that's me done.
Thank you so much, Patrick. Thank you so much for speaking. So we have got a question here I'd like to just share with you. Maybe you can provide some insight. Somebody's daughter has turned 18. She's never accessed mental health services. She's going to be going to university, so she'll be registering, I assume, as a temporary patient there. Obviously, we'll have her GP practice back home as well. How would you advise she goes about accessing mental health services in that situation? Could she choose to access through central Bedfordshire as opposed to where she's going to university? Is that something you know much about?
Yeah, certainly. So if she's not already open to our services, then we would require a referral to come through. That would come through a general health provider. Generally, it would be the GP or any other particular primary care health provider that's working with her. That could come to us, and we would again it would come to our triage team, and we would be looking at how we could best support this person. What I understand now with most universities, and certainly the work we've been doing around our local ones, is that they are very much switched on into student welfare, and many will be providing a wide range of services that students can access whilst they're at their university, of generally around counselling services, but also other sort of holistic care being offered as well. And they will tap into their local areas, into local secondary services should they need to. And the same would apply here. If somebody we have at Bedford University here should be becoming unwell, then we would get a referral, and it was felt it required secondary care services, we would accept a referral from them. And the important thing is that the person's at the heart of this, and not and not the postcode or the provider is, we would certainly, they could certainly reach out to us, and we would provide that support. So you can do it both ways: either come through us if the person's already here and refer directly, or wait until they're at the university and access what services that they will be providing, and they're able to tap into local NHS services should they want to.
Lovely. Thank you so much, Patrick. So we've had a couple of messages as well about having contact information and slides shared. So I'm going to post a link just to a feedback questionnaire for everybody if they can share with me. There's a section to leave your email address, and we'll get the slides off Patrick and all of our other speakers, and we'll circulate them if you want to. So I'll send that in there now, and it will be the first question there. So if anybody wants any of the information, please do that. So thank you so much, Patrick. We're going to move on now to our Bedfordshire Recovery College, I believe. Do we have someone from the Bedfordshire Recovery College?
Yes, Asia, that's me, Sarah.
Lovely. Hello.
Hello, hiya.
Are you able to share your screen? Is all the technology in place? Beautiful.
I hope so. Let me have a go. Patrick done it so wonderfully. Let's see if I can copy. Okay. Is that, can everyone see that? Are we sharing?
Perfect. Thank you.
Brilliant. Okay, so my name's Sara McClurg, and I am a lead coordinator at the Bedfordshire and Luton Recovery College. So I'm just going to go through I've just got a couple of slides just to give you a bit of an overview of who we are and what we do. So we are an NHS service. We are primarily a mental health service, and we work as part of the Mental Health Academy, which is a partnership between ELFT and the University of Bedfordshire. We're also part of the transformation that Patrick's just been talking to you about, and we work closely within the service as well. And that means that we can often work with other professionals to be part of someone's discharge plan, or even prevention of having to go through the services. So what we do is we offer educational courses and workshops, the focus being on mental health, wellbeing and recovery. So they are educational, but not like, it's a bit misleading, the word college. People often say to us, oh, is it you come to a classroom like a regular college? Not quite, but we do want people to get something out of it. That's the educational part, is that we'll teach you new skills, new management techniques and new ways to manage and work through whatever it is you're going through at the time. That's the educational part. So we're an inclusive service, and we're open to anyone who is over 18 and lives or works in Bedfordshire. So it doesn't really matter where your GP is, as long as you're living or working in Bedfordshire, you can come to us. We're very accessible in as much as you self-enroll. You don't need to have a referral from another service. You can just have a look at something you want to do and give us a call and sign up to do it. You don't have to have a diagnosis. You don't have to have mental health issues. It can be really about socialization, not being isolated, trying something new, coming to meet new people. They're the sort of things that we offer, as well as more specific sessions around mental health based issues. So the way to enroll, it's really easy. You can access us online. You can enroll online. You can look at our current prospectus. We work termly, and every term we produce a prospectus of our courses and our workshops, and you can see that online, or you can have a hard copy sent to you if that's easier. And then you can just give us a call. You can do the form online, or you can come into one of our bases just to enroll. You do it all yourself. If you are working with a care coordinator or support worker, obviously they can support you to enroll with us, but we do encourage the person that wants to attend to fill in the details. Our bases, we have a main base in Bedford near the train station. We have a base in Luton at the Central Library. We have a base in Leighton Buzzard, which is at Wichello's Wharf, the lighthouse there. There are 3 main bases, but we do work across the county. We cover central Bedfordshire as much as we can as well. And at the moment we have sessions going on in Ampthill, Biggleswade, Stopfold, and we've just started a new one in Meppershall at the Village Hall with the idea of capturing that area around Shefford. So that's quite a good place to be situated. The main thing to say as well is all of our courses and workshops are free. Because it's an NHS service, there's no need to worry about paying. A lot of people ask us that, so I thought it was quite good to mention it. Oh, there we go. Did that work? Yeah, that's the next slide. So what our sessions are, really, they're made up of what we call co-production. So that would be a person who is experienced by profession, and then a person who is experienced by a lived experience of that issue. That is what we aim for. There's a little list on the other side of the slide here. That's just an example of some of the courses that we offer. So it's very, very various things. It is very varied. So we do some sort of creative things around self-discovery through writing. We do more practical things like money matters. Model making is quite a nice one to do as well. And we look at things, issues like dementia, depression, anxiety, voice hearing, anything you can think of, really, we try to cover. So to do this, we work in partnership with a lot of other organisations to bring that professional experience into the sessions as well. So we work quite closely with the Alzheimer's Society, Autism Bedfordshire, the Luton Adult Learning Centre. And how we deliver our sessions, we do a lot of sessions in person. So that might be at one of our bases or one of our, I say bases, we call them sort of satellite bases out in central Bedfordshire. It might be an online where you can just access it quite easily with a Zoom link, or we do what we call a blended session, which is where you can either choose to come into the classroom, but then people will also come in on Zoom, so we can capture more people in that sense. That's not always comfortable for everyone. We appreciate that. So, but you do have a choice. Now, the other thing I just wanted to mention briefly, because this is something that not many people know about, but it is on the enrolment form, a little box to tick if you'd like one. And a lot of people tick it and then go, I don't know what it is. So I thought it might be useful just to talk about an individual learning plan. So really what this is, it's a chance for you to get to know a member of the team. It's a chance for one of us to get to know you. It's a brief intervention, so it would be an initial session and perhaps 1 or 2 follow-ups afterwards. So you'd meet on a one-to-one basis with one of the team, and the idea is to just talk a little bit about where you are at the moment, what you're struggling with, what you're not struggling with, what support you've got, and to make some goals and to think about where you'd like to be and how the Recovery College can help you to get there. So within these sessions, we'd also look at the courses that might be appropriate to you, and we'll put together a plan and a list, and then we can get you signed up and enrolled on the right course for you at that time. So it's a really good thing to do, actually, especially if you're new to Recovery College, just to get an idea and to be able to have a chat with someone about what you can do and how you can use the Recovery College to your benefit. And I think that's all of it. This is just our contact details, which I believe will be circulated. And if you've got any questions, you can just give us a call or an email and ask us anything that you want to know. And that's me.
Thank you so much. We just have a question. Could you just go over how somebody can contact you to refer themselves for a college course, and also if there are any courses that aren't happening in the daytime when people might be at work? Are they things that you could go over and answer for us again, please?
Yeah, so the first thing about enrolling with us, it's as simple as you can Google search us or go onto our website and literally just download the enrolment form online, and you can fill it in all yourself online. Or you can give us a call and one of our admin team will be happy to sit and do that with you on the phone, and they'll fill in the form for you. Or there are, in the prospectus, there is actually like a tear out enrolment form, or you can ask for us to send you a form and do it the old fashioned way, paper and pen, and then just bring it back to us or send it in. So it's quite accessible, and any problems at any point, just give us a call and we'll talk you through it. and we'll help you. But it's quite simple. And once you're enrolled, once you do your enrolment and you're enrolled, you don't have to enroll every term. Once you're enrolled, you're in, and then each term you can just let us know, email, give us a call, let us know what you want to do that term. So you don't have to do that process again and again. You're already done. And what was the other question, Age? Sorry.
If there were any non-daytime classes, I think we've got somebody who would like to enrol, but they're working through the day. If there's anything else that we have available.
Yeah, we are a 9 to 5 Monday to Friday service at the moment. However, we are trying to do more things outside of those times. We do appreciate that we're trying to be, you know, accessible to everyone, and then we say, but only if it's in working hours. So we are trying to accommodate by having different events at the weekends, doing some more sessions in the evening time. We also have for people that live in, or well, for everybody, but can get to Bedford on a Thursday evening, we have what we call the Bedford Beacon, which isn't strictly a recovery college service, but it's a drop-in evening, and it's at our Woburn Road base in Bedford. It's run by the recovery college staff, so that's a really good way as well if you wanted to come in and meet some people. So if anyone wants any details about that, I can do that. But yeah, we do appreciate the out of hours aspect, and it's a bit of a work in progress, because obviously we're not contracted to work, but we do, so we try. Yeah. Anything
Absolutely.
else?
We're always striving to do better, aren't we? So just because we're not there yet doesn't mean that we're not ever going to get there. But yeah, thank you so much. Thank you for sharing some time with us and sharing some information. We're going to move swiftly on. We've got CAMHS next, the Child and Adolescent Mental Health Services. Do we have someone from CAMHS?
Hi, yes, I'm here. I'm not very technical, so bear with me whilst I share my screen. Okay, can you see that?
Yep, all good.
Wonderful, great. So I'm going to talk about CAMHS, the Child and Adolescent Mental Health Service. Just going to tell you a little bit briefly about what it is, how it works, and most importantly, how you get a referral into us. So we are part of the NHS, and we provide mental health services, help and support for children and young people up to the age of 18 years. And in this area, it's provided by East London Foundation Trust. So I've put on there that we treat moderate and severe mental health conditions. And I think, you know, traditionally that's what CAMHS has been, but we also can provide support for less severe mental health difficulties, so the kind of a low to moderate as well. And I'll tell you a little bit more about that, because I think some people probably think that CAMHS is for, you know, for young people that have got, like I said, quite significant mental health needs. And what we're really trying to do is increase that access to it. So in CAMHS, we work on something called the Thrive model, or the Thrive framework. And it basically, you can see from this diagram here, we've mainly got 4 of quadrants that model is split into. So any referral into CAMHS comes into that green quadrant. Any referral that comes in will be looked at, and that person will be given advice at the very least. We might decide that referral, when looking at it, that they need some help. So the next section would be getting help. And CAMHS covers some services in this area. So we cover a lot of kind of this area in schools. Now, at the moment, I would say Bedford has a better kind of coverage of that than Central Beds, but some of the schools teams have recently recruited some mental health support teams, and they are being trained at the minute. So I would say watch this space for, if you've got young people that are in schools in central beds, then you should kind of hear a lot more about support that's coming in the next few months. And then for some of our young people, they might need more help. So in that purple quadrant. So we have lots of different teams within CAMHS. And again, this is just to give you a little bit of a flavour about how CAMHS is made up. You don't have to remember any of this, but it's just to say that we have got specific teams for young people who are maybe looked after by the local authority, who are in care. We've got an eating disorders service, we've got an adolescent mental health team, neurodevelopmental teams, teams for young children, and our general emotional and behavioural teams that offer support for the moderate to severe. And then in that final quadrant, we've got teams in the orange quadrant, the getting risk supports. So for those young people where possibly a kind of a 9 to 5 service is not enough, and actually they're at significant risk where we need an intervention that's more than that. So at one extreme of that is an inpatient provision, and we do have, sometimes young people that have short inpatient admissions, but we also have teams that kind of go into the home, such as home treatment teams and crisis teams. And for young people that need that help, they will often kind of go between the orange and the purple segments. So they might, for example, be held under one of the teams in the purple quadrant. They might have therapy and see somebody once a week, but they might need additional support out of hours, so they'll have certain numbers and teams that they can contact who can see them outside of those hours. But what we're really trying to do is we're trying to build up those sections, those quadrants of the green and the blue, and the idea being that the more young people that get advice and get help, that the idea is that it prevents them getting to the latter quadrants of needing more help. So where I work is in one of those teams that comes under the blue quadrant, which is the primary care access service. And we are a service that works kind of quite closely with the GPs. So I can tell you a bit more about that in a minute. So our CAMHS offer for moderate and severe difficulties, we offer lots of different types of therapy, some that you might have heard of, and every young person that we accept to our service, we start with an assessment to fully understand what might be best suited for them. So we try to be quite person-centered and look at really what is best for that person. So there's just some of the different approaches that we offer across the teams on there. So we have cognitive behavioral therapy or dialectical behavioral therapy. You can see on there we've got different types of therapy. So we have lots of art therapists, trauma focused therapy for those that are that have suffered from trauma. We have teams that also can provide medication and psychiatry reviews. We also at CAMHS, we will provide autism assessments for young people that are over the age of 12. And that can be quite confusing, I think, sometimes for parents and carers, because for children that are 12 and under, autism assessments are done through the Child Development Centre and not through CAMHS. So it was just to point that out, because it's not completely clear. We have risk management, so we will safety plan and manage the risk of young people who have got kind of riskier behaviour. And we're made up of lots of different professions at CAMHS. We have psychologists, psychiatrists, art therapists, family therapists, counsellors, social workers, mental health nurses and child wellbeing practitioners. So we've got lots of different treatments that we can offer. as I said, what we're trying to do is also really increase that offer for the low to moderate difficulties as well. And that's done, like I said, primarily through my team, which is the Primary Care Access Service. And we can offer, again, we will offer assessments, and we can offer treatments and interventions as well, but on a much shorter term. So normally, for example, 6 to 8 sessions. But for those of you that are in these GP surgeries, you have a link worker. I've just put her name on there because her name might come up, and that's Narai. And you might see Narai in some of your surgeries. She doesn't work in Lower Stondon, but she works across the other surgeries in this area. And like I said, we really were set up to try and make sure that young people are getting help before it gets to the stage where they need more help. So the key thing here really is how to make a referral. So you've got one of 2 routes. You can make an appointment with your GP, and your GP can make a referral into us. So you just make an appointment with your GP and just say, I would like a CAMHS referral, and your GP can do that for you. You've also got the option to self-refer, and young people, you know, if they're happy to, they can do that directly, again, or a parent or carer can do it for them. And I've put the link on there. So if you go onto that link, it comes up with our main CAMHS page, and there's a button on there that you just click that says self-refer, and then you fill in an online form. It's not too long, so it's fairly straightforward. So it's just that you've got both options there for referring. So the referral process, regardless of whether you have referred yourself or your young person, or whether you've gone to your GP for a referral, it all comes into exactly the same route. It comes into CAMHS via what we call a single point of entry, or SPO. We love acronyms in CAMHS. What happens then, once we've received a referral, you will be contacted within 5 working days. Somebody will call you. And in that call, you will either be asked some triage questions, or you will be invited directly in for a face-to-face assessment. And that depends really what team you come into. But either way, you'll be contacted within 5 working days. And then from that, you'll receive a decision about that referral. So if you've been called and asked some triage questions, you'll then be discussed in, we have a twice weekly single point of entry meeting where all those referrals are discussed. Oh, excuse me. Sorry, I'm just gonna have a drink. And from then the decision will be either that you'll be, or your young person will be accepted for an assessment at CAMHS by one of our teams, and then you'll be contacted by the teams. Or if it's decided that actually CAMHS is not the right kind of support for your young person, you will be given some signposting information about different services and how to access those. So every referral that comes in, like I said, will be contacted and will receive at least an outcome of that decision, if not an assessment. And then just my last slide. So the other thing that I just wanted to let you know about briefly is something called Luminova. So this is actually, it's a digital therapy game, and it's something that we use in CAMHS quite a lot. But just recently, we've been able to open it up so that anybody can access this. And so if you want to access this, you don't need a referral into CAMHS. Anybody can access this. And it's a game that's actually recommended in the NICE guidelines, and it can help with confidence and also in dealing with anxieties, some specific anxieties. I've put some on there as an example: sleeping alone, fear of going to school or speaking in class, certain fears of dark or being sick. It's an intervention for 7 to 12-year-olds. It has a really good evidence base, so we're seeing some really good results with it. And like I said, I wanted to tell you about it because the big change is that you now do not need to go through us at CAMHS to access this. You can literally visit that website, and it gives you all the information you need to do to sign up for it, and it's completely free. And that's the end, so I will just stop sharing.
Thank you so much. We actually have a few questions. You're very popular. So first of all, are you able to tell us a little bit about the boundaries or the distance or the differences or the overlap perhaps between social services and CAMHS?
Mm-hmm. Yeah, so I'd say we do work quite closely with social services, and I guess also particularly early help. So for those that aren't aware, early help services are services that are, although they kind of sit within the local authority, they're lower. They don't meet the threshold of social care, so they're lower than that. And quite often what we find is that we will assess a young person and meet them and their family, and we might decide we might decide it's an either or. We might decide actually that there's something we can offer them at CAMHS, but we might also decide that there's some particular interventions that we think early help could offer them as well. So we will not, sometimes we'll make that referral and sometimes we'll ask school to do it. That would be completely with family consent. We wouldn't do it without consent. In terms of social services, if we've got a young person who is already open to social services, so a child that is on a child in need or a child protection plan, it's always helpful to have links with the social worker from the start, and it's something that we usually ask in an assessment. We normally ask the family if they're open to social care or if they ever have been, and we ask for permission to contact the social worker, share information with the social worker. Again, that's obviously, it's up to the family if they want to give that consent. Of course, if we had any issues that came up in an assessment or any treatment or anything where we were significantly concerned about a young person, we would make a referral to social services. We'd always try and do that where possible with the consent and knowledge of the family. There are, of course, rare circumstances where we'd have to do it without. But we have a lot of young people that are also open to social services, and I think that there's a huge overlap between young people that are struggling with their mental health and kind of where that comes from, and a lot of the time we might have young people that are really struggling with anxiety, for example, and it's about really trying to identify where that anxiety comes from. And a lot of the time it might be that it's we see it as predominantly that mental health issue is not being helped, for example, by the social context, and so it might be really helpful for us to speak with any social workers that are involved, and we're always happy to join any meetings with social care as well, but like I said, it's always done with consent of family, unless of course we have a significant safeguarding concern, where we would have to make a referral, but other than that, it's something that, like I said, we'd always discuss with the family in an assessment, and it can be really helpful sometimes to work together so that we can tackle the mental health aspects and social care can maybe tackle some of the other social aspects that are going to help the young person.
Fabulous. And just briefly, are you able to just go over the differences in cognitive and dialectical therapies, and also what kind of qualifications your therapists hold, what are their backgrounds, etc., or will that vary from person to person, I imagine?
Yeah. Okay. So CBT, or cognitive behavioral therapy, that's something that kind of every team in CAMHS offers, actually. And so when I was talking about my team and how we work with that kind of lower to moderate mental health presentation, we can offer what's called a low intensity CBT, and we have certain therapists that are trained specifically in low intensity, and with CBT it's working on kind of that link between thoughts and feelings and actions. So something very simple could be, I'm feeling really down today, I feel sick, I feel anxious, I don't want to go outside and see people because I don't feel like it. So then you don't go and see people, but then actually that makes you feel worse. So CBT is kind of working on breaking that cycle. DBT, or dialectical behavioural therapy, again is something that all teams offer, because we can do that again on a kind of a short intervention or a longer term intervention. And DBT works really well with young people who are might have quite kind of mood swings or quite impulsive behavior one minute and not another. It works quite well with young people that, again, like with that impulsive behavior might lead to self-harming, young people that might be having real difficulties, kind of emotional difficulties with friends or with family members. Both of those therapies are really working on providing a young person with strategies, and both of them kind of involve quite structured therapy sessions where a young person is being asked to do homework in between those sessions. But like I said, the CBT can work really well for low mood and anxieties and fears and worries, and the DBT can work really well for some relational issues, emotional issues, impulsive issues, and self-harming behavior. And in terms of the qualifications that our therapists have, yeah, it really ranges, to be honest. Like I said, we have psychologists who will have, done their psychology doctorate. Mental health nurses will have done their mental health nursing degree. I'm a social worker by background, so I have a social work degree. However, working in CAMHS and working in mental health, we then have a lot more training. So we have training in CBT or training in DBT, or lots of kind of different. So each therapist, I guess according to what their interest is, they will specialise and have additional training in that. And then if that matches with what therapy would be good for your young person, then you'll be matched to that therapist. So yeah, lots of different qualifications, but yeah, most people have got some kind of degree or postgraduate degree or doctorate, and all therapists will have had significant additional training from that.
Fabulous. Thank you very much. And we do have a few other questions, but I'm afraid we're going to have to move on because we've still got quite a few people to go through and speak. So if we haven't answered your question, please use the form that I've popped in there, and we've been replying to messages as well, and pop your email address, and then we'll get you the contact details for CAMHS directly. You can speak to someone who knows what they're talking about and will give you the right information. Yeah, it just goes to show that, everybody has a different background, but we can approach mental health from a different perspective. The games are fantastic. I've seen lots of research about ADHD based games. They're quite big at the moment as well, aren't they? So just shows you can be really creative in how you care for your mental health and how you develop your mental well-being going forwards if you are able to put the time into it. Fabulous. So we're going to move on to the Bedfordshire Discovery College now. I'm hoping we've got somebody to share some slides or some things.
Hello, good evening.
Hello.
Hi, pleased to meet you, Asia, and good evening, everybody. My name is Mihaela. I'm part of the Discovery College team for Bedfordshire and Luton. And let me see how to work this. Oh, wonderful. Wonderful. Can you see this?
All good. Yes, thank you.
Yeah, all good. Thank you very much. I work for the Discovery College Beds and Luton, and just because you were speaking about a different perspective, Asia, when it comes to mental health and well-being, we are here to bring that different approach for the young people in our community. The Discovery College is an NHS educational service that promotes mental health and well-being for young people, and we've run on a strength-based model, the same like my colleagues from the Recovery College. You've had Sara earlier mentioning a similar model. Some people might say that we are the younger sibling of the Recovery College just because we work with under 18s, with 13 to 18s. What that means is that we are looking for what's strong in an individual rather than focusing on what's wrong. Any young person 13 to 18 years old living or studying in Bedfordshire is more than welcome to join our workshops, regardless of their cultural background or ethnicity, education, and so on. Including obviously young people who are part of CAMHS, just because I was speaking about what's strong. So even if someone may have a diagnosis, there's still things that they can build on, and they can build on self-esteem, and they can build on that through their hobbies or through discovering new things or connecting with young people who have similar interests. The workshops are all free because we are part of NHS, and they are held online or face-to-face across the borough. We do our best to cover as much as possible. Generally, until the autumn term, we held the workshops more in Luton and Bedford, but in the autumn term, we were lucky to be in Flitwick, and this spring term, we will be in Dunstable with 2 of the workshops. So we are very, very pleased about that, because Central Beds is an area that we are interested in, and we would like to connect with more young people in the area. There's no referral needed, and there's no waiting list. What that means is, and I will share a QR code on the next slide. That means that any young person can just scan a QR code or register using that registration link. They only need an emergency contact over there. And obviously, if they have any special needs, they can fill that in. So we are mindful when delivering in accommodating everybody's needs. We sit, my colleague Victoria from CAMHS presented earlier that frame, the I Thrive frame with green and blue and purple and orange. We sit in the green area. We are there for signposting and getting advice, because our main goal is to give the young people that we connect with the tools necessary to take care of themselves the best way they can, and to create a life that they want with the help of the adults around them, because we believe it takes a village. We believe that a young person can thrive only if supported by their communities. That's why we also welcome carers, relatives, and professionals in our workshops, as long as the number of adults is not overwhelming for the young people in the room. You will see here, this is our NHS service page, and don't know if you can see the bottom one where is the Instagram page, but because I can't when sharing this, but I hope you can see that. If not, let me move to the next slide, and here is more visible. So you can, like I was saying, a young person can register by scanning this QR code, and that will take them to the registration page. Right now, it's just been updated with the spring term workshops. There's going to be 12 workshops starting from the 19th of February until the 25th of April, 6 face-to-face and 6 online. There's a choice of 6 workshops per term. So a young person would just go there, fill in the details, and just select the workshops that they want to attend. The workshops are free, as I was saying, and strengths-based, but they are non-clinical. What that means is we speak about sensitive topics related to mental health and well-being, but in a Discovery College language, we call it, in a friendly language accessible to everybody. We stay away from the jargon, we stay away from words that are being used in a clinical setting, even though the workshops are informed by theoretical frameworks. They are co-produced and co-facilitated with the help of other young people. So usually there's a subject mentor who is someone that might be trained by experience, or they can just by experience means by academic experience, or they can just be trained by lived experience. And usually a young person who has their own story, their own resilient story in an area. They can be previous service users that have been through the services like CAMHS, or they can just be volunteers in the community who just want to give their example of coping with challenges or overcoming challenges in a way, in a healthy way that was empowering for them. A very good example for that is the new workshop that we will have in the spring term about animations and well-being. And that will be co-facilitated by a young person who has used digital animation as part of their well-being. And it's about creating and what benefits that brings when we are dealing with challenges and we just need to take a step back in order to return to the challenge, or just to see if we can do something about it, but with a fresh perspective and with a fresh approach. The workshops are discussion based. We do our best to keep them as interactive as possible, because everybody needs to be given the chance to express their own opinion. There's a maximum of 10 young people in the workshops, especially for the face-to-face ones, and especially for the creativity ones, just to keep it fun, just to keep it engaging, because we're not just ticking boxes, going in front of the young people and just speaking about the subject that we like. We really do believe that the knowledge is in the room, and we learn from the young people as much as hopefully they learn from how we have done things when we were in difficult situations. All the workshops are culturally sensitive, because Bedfordshire is a very diverse community, and we are very mindful of that. They are usually held after school hours, after 5 p.m. For the face-to-face ones, there are 5 to 7 usually, and the online ones is 5 to 6:30. However, in the half terms or during the holidays, especially the summer holidays, they can be held during daytime from 1 till 3. We have grouped the workshops under 5 themes, after an umbrella of 5 themes: personal growth, healthy relationships, mental health and well-being, life skills and creativity. So we can have under personal growth, self-esteem. The self-esteem workshop is a very famous one and a very looked after workshop, because self-esteem is the engine of our identity, and we need to build on it, and it would be a great thing for a young person to have this tool in their toolbox. Understanding anxiety and low mood, even if it's quite largely discussed, and there are lots of organizations and services who address this. As I was saying, we do it in a familiar way, in a friendly way, speaking about our experiences. Some of the peer mentors and some of the subject mentors that have facilitated this workshop also have a diagnosis. They have a history in anxiety or depression. So that's where the lived experience comes. There's the creating jewelry or baking or music and music, art and mental health workshops, and those are part of the creativity area. There's stress management or building resilience. These belong to life skills, and obviously CV writing and interviewing skills. And something that I forgot to mention is that being a college, it's not because we are a college per se, it's just because we work in tandem with the school terms, and we also give certificates of attendance to the young people coming to the workshops, and they can be a very good addition to their CV if they are over 16 and they are looking for a job. So thank you. I'm going to stop sharing now.
Thank you very much. Some amazing courses available there. You actually don't have any questions, so that's fantastic. I think we're going to move swiftly on to our next speaker, because I do believe she has something to do at 8 p.m. Busy little bee. So let's move on to Bedfordshire Rural Community Charity. Do we have you here?
Hello, can you see me?
Hello. Yes.
Lovely. Okay, let me just get the screen up. Oh, what can you see? Because I can't see much.
You can see your slides, not in their slideshow form, but we can see them.
Oh my goodness. It's not letting me play. Oh, this would happen, so I'm just going to do it like this.
So if you go down, you see where your zoom is on the bottom bar at the bottom. The icon on the left of the zoom bar. One? Yeah, the first one that looks like a little screen. If you click that.
Ah, there we go.
Hey.
Oh, I'm not very good at PowerPoint.
It's all right. It's all right. We expected that today. Don't worry. Take it away, Steph.
Trust it to be me. So I'm Steph, and I'm the social prescriber for Ivor Valley South. So it's just a whistle-stop tour really on what social prescribing is and how we can support you. So I work for BedsRCC, which is a charity which covers the whole of Bedfordshire, so not just central beds. It covers the whole of Bedfordshire really. So there we go. Oh, hang on. So what is social prescribing? So it is a key component of universal personalised care. So it's an approach that connects people to activities, groups and services in their community to meet the practical, social and emotional needs that affect their health and well-being. So what can we do as social prescribers? So we aim to help people take control of their own health and well-being. So it's a very holistic approach. So it's what matters to you, and we work with that. We aim to support people to connect with local community services, so anything that's going on in the local area. And one of our biggest assets is time. So we do have initial appointments which can last up to an hour. We currently don't have any waiting lists. So once you're referred, you'll get a triage call within within 48 hours. So there's no waiting list at the minute. We offer an average of 4 to 8 contacts with a client over a 3 to 6 month period. Again, however, this is person-centered, so this will vary depending on the need of the patient. It can be one session, or it can go on for a year. It's really So all of our work is underpinned by our health coaching skills. So every social prescriber is health coach trained. So that enables us to empower clients to develop the knowledge, skills and confidence to become more active in their own care. So who can we support? So anyone with social isolation, so clients who may be feeling socially isolated, people who live alone, known anxiety, people that make frequent calls to services, so like the ambulance services. We can help support new parents or need groups of parents, so any SEND parents out there, other local parents to network with, carers we can support, so the carer or the cared for. Anyone new to the area, people suffering with poor mobility, so also adults identifying as needs, so not in education, employment or training. Anyone recently bereaved, retired and want to volunteer, and those with low to moderate mental health. So the referral criteria at the minute is anyone aged 18 who would benefit from health coaching and non-clinical support. So like I said before, these could be carers, those who are socially isolated, history of mild to moderate mental health conditions, long-term conditions who are not responding well to medical intervention, those who have capacity to self-manage with community-based support, frequent attenders at GP surgery for non-medical reasons, and we work closely with people like the care coordinators, the pharmacists and the GPs, and other local services as well who can refer into us. If you've gone to see them and they feel that there's a social prescribing need, they can just send us a referral and we can contact you. Or you can self-refer. So if you visit this website, there will be an option to self-refer to us. These are my contact email, which I will put in the chat for you, because like I said, I do have to shoot at 8. So if you wanted to send me any questions, I'll be happy to answer them. And that's it. Oh, how do I get out here? Sorry, I'm not very good at saying that.
You are absolutely fine. You did a grand job. Thank you very, very much. Yeah, great. So you had Steph's contact details there, but as we've been saying, we've been putting that form in the chat. So send your email address to us, and we can make sure you get those contact details as well. So next, I do believe we have one of my favourite services. I won't lie, every patient that I speak to who uses your service absolutely loves it. So we've got for Men to Talk. I believe we have Luke. Are you here?
I am here, yeah. Let's see if I can. Oh, is it the actual share button we have to use?
Yes, please.
Let's do that. Bear with me. Oh, I can't find it. Bear with me. Apologies. Is it give control? Apologies for this. I can't see it.
You're totally fine. I think you're sharing your screen. I think we just need the correct one. So are you able to switch it to the... There you go. That looks
Is that
right.
it? Brilliant.
That's it.
I know we're a little bit on the time, so I will skip a couple of slides which won't be relevant. So yeah, this is for Men to Talk. My name's Luke Newman. I live in Potton, Bedfordshire. I've lived in this area all my life. Grew up in Sandy and moved to Potton and Biggleswade over the years, so I'm very local to you all. For me personally, I've suffered with grief and anxiety and OCD over the years. Touch wood, I'm doing very well at the moment through some techniques that I've learned. This was after losing my mum Jen in 2005 at the age of 54 to ovarian cancer. But then I also lost, unfortunately, my sister Heidi in 2015 at age 44 to breast cancer. But the thing with me is that I can always talk about it to anybody on the street. That's to my family and friends, but also strangers on the street. But I know it's hard for us men personally to do that. And after having 2 sets of counselling, and that's grief counselling, CBT therapy, I felt like there was no further help or support out there, especially for men, to be able to talk about how they're feeling. So in December of 2019, I formed For Men to Talk, a chance for men with anxiety, grief and depression to come together in a supportive environment, improve men's well-being and try and talk about how we're feeling. So we launched our first group in January 2020 in Jones's Cafe in Biggleswade, and over 20 men came per session, which was just an incredible number. You know, I thought that 3 or 4 men would have been come through the door, which again would have been great as long as we could help some men, but I could see there was a real need for it. We had 3 further sessions until that small little word COVID crept in born, and we moved it all online virtually every Wednesday, and we've been doing it ever since. So we've been actually going for nearly 4 years, virtually every single Wednesday at 6 p.m. In August of 2020, instead of just calling it a group, it's called a community interest company. So it's a non-for-profit company, which is a benefit to the community. It's very similar to a charity. But what we do, we don't just talk about mental health discussions. We talk about football, sports, TV, movies. You know, we have a little competition sometimes, like who can do the best scenery photo. We have, and this was really hard to do on a virtual background, but we actually did a cooking bake-off. You know, we couldn't taste it like Mary Berry, but it was very good fun. And we also had a grow a beard, which I'm still doing mine. I can't really get rid of mine now. I liked it that much. But we also talk about the 4 pillars of well-being. So that's sleep, exercise, stress management, nutrition to improve our mental health. And then we also talk about the other thing that men don't talk about, and that's our physical health. So You know, we talk about the symptoms of testicular cancer and prostate cancer, because we know that 1 in 8 men in the UK will have prostate cancer in its lifetime. So we do have presentations from the likes of Prostate Cancer UK. For those who do know that 2 or 3 years ago, when a footballer had a cardiac arrest on the pitch, you know, we talk about those sudden cardiac arrests and what you can do, and look at the what you can do if that happens in front of you. So what I want to try and do is to have a safe, supportive and confidential environment so men can talk freely. And I feel like over the last 4 years, that's what we've been doing. So in 2023, we had a total of 143 meetings. So with over 1,700 attendees. So that's in local groups in Bedfordshire, Cambridge. So we're now running Biggleswade, Sandy, Potton, St Neots, Gamlingay, Bedford, Hitchin now, and we've still do the virtual meetings, and we also do walking groups once a month as well. And why do you say about walking groups? Well, we know that walking groups can enable men to have better sleep, it gives a happier mood, it manages stress, anxiety and intrusive thoughts, gives us better self-esteem, and it reduces the risk of our depression, and it connects it with people, you know, so you do make new friends. So we've been doing that for since August of 2021. And we do that every month, averaging about 10 to 15 men per meeting in Biggleswade. But like I said, we've just launched in Hitchin as well. So we do that twice a month now. And that's actually run by a guy who actually came through for Men to Talk as a guy who was struggling with his own mental health. Now he actually runs his own groups, his walking groups, which is fantastic. And in 2022, we also interviewed on the Anglian News as well, which was great, because it's good publicity for not just us, but also for men's mental health. And for our sins, we've actually done this a couple of times, and we've been actually starting training this coming Sunday. We've actually done walking marathons. So guys who have been enjoying the walks, we get together once a week for 12 weeks. So we start off with a 4-mile walk. The following week we do 6 miles, and then we do a 26.2 mile walk. Now, for those who don't know, during COVID, we actually had a you can do do the London Marathon from home now, as long as you do that 26.2 miles in 24 hours. So if you sign up through that, you actually get a London Marathon medal. So not only did I get a London Marathon medal from running it 10 years ago, I've actually got 2 further ones from a walking one, and fingers crossed a 3rd one come April. But we've also launched now for Men to Talk and Fish. So 8 guys going around the lake. So it's 2 by each pod. So not only do they fish, but they also get to talk about mental health at the same time. It's run by a fully qualified facilitator who has a level 2 angling coach with over 20 years of angling experience. And they also provide the tackle. So there's free bait, there's everything's provided for you. And that's worth a lot of money. Usually I think it's £26 a session. So we've actually got this fully funded until I believe it's September of this year, once a month, which is just amazing. And we've also just launched, and this is run by a gentleman, a good friend of mine who, again, come through from Men to Talk. He was diagnosed with autism in his 50s. And now every couple of weeks now, he runs for Men to Talk about autism. So it's tailored for autistic men with autistic family members, or men who are waiting an autism diagnosis, because we do know about the wait can be 2 to 3 years. So we have 2 meetings per month virtually. Actually, this is, I should have really stated that this is virtual on Zoom. I think it's every 1st and 3rd Monday of the month. So this will be next Monday as well. I've also designed and written a book called The Mental Health Moles, designed and written by myself. It's for men, women, boys and girls of all ranges. It raises awareness of mental health, and every single penny that raises money goes back into for Men to Talk, so I don't personally earn a penny from that. So the feedback I'm getting from the men is that men have long needed to speak up, and this personal growth is thanks to the supporting of the supporter group as for Men to Talk. And I don't like really talk about this, but I think it's important too, because it actually again promotes the good work that we've done. I was awarded a BBC 3 Counties Radio Make a Difference Award 18 months ago, and I also won 2 awards at the Luton and Bedfordshire Community Awards. And so what next? So again, this is for everybody. So for any man who comes to who wants to come as an attendee, by all means, you know, but like I said, go to the Men to Talk website. We're arranging 10, 11 towns now up and down the country, but about 8 or 9 locally. But if you fancy, you know, forming your own one, so if you want to do a walking group in Sheffield or sit down meeting in Sheffield, you know, we're looking for facilitators. There's free training out there. You know, this is a peer support group. And like I said earlier, we've just launched a walking group in Hitchin as well. So by all means, there's a walking group in Hitchin and in Biggleswade. We have sit-down meetings and virtual meetings, fishing meetings, autism meetings now. And I'll breathe. Thanks very much for listening.
Thank you so much, Luke. Yes, your service is something that comes up a lot in my chats with patients, and they all say that sense of community is the biggest thing that's helped them. And I think, Mihaela, you said earlier, it takes a village, and I think that goes for everybody, even if that village is your support network through something like this, or through the Recovery College or the Discovery College or through the mental health team. It is really important to have that social support around you. So I think what you're doing is absolutely fantastic as well. And we've even got a comment there to say that, yes, fantastic that men are talking to each other. Well done, and keep chatting. Amazing. Thank you for your time. I believe we have carers in Bedfordshire next. Do we have someone from carers in Bedfordshire?
Yes, I am here. Hello.
Hello,
Let
hello.
me just share my screen. Hello, everybody. Here we go. There we go. Come on. Right. So my name is Bella. I'm from Carers in Beds. I'm the wellbeing practitioner at Carers in Beds. So I mean, we provide so much different support at Carers in Bedfordshire, but and we define a carer as anyone providing unpaid support to a person in their lives with additional needs. So that could be a friend, a neighbour, it could be a daughter, son, anyone in your life that you're kind of providing support for, which is unpaid. And we've found that carers show decreased well-being due to the strain that a caring role can have, in addition to things like school, education, work, and all those, and just cost of living in general. So we provide a lot of different types of support. So the support I provide specific wellbeing support. So I provide one-to-one sessions with carers. I provide monthly webinars and digital resources. All of this is free. We also have links with counselling services where we can provide free counselling as well. We can also offer young carers wellbeing support, which is more specialised to I think 10-year-olds to 25-year-olds. We offer employment support, financial advice, and also bereavement support, which I think are all really linked to wellbeing, really. And yeah, I can't go to the next one. So this is just our contact information. To access our services, you do need to be registered as a carer with us, but it is a really simple process. So it's just about calling up or emailing, and we can get someone in contact with you. You can do your registration through the post, you can do it in our office, you can do it over the phone, you can do it on the internet, you can basically do whatever you like, really. And yeah, so if anyone has any questions, that would be great. But that's just a really quick kind of whistle-stop tour of what we offer.
Fabulous, thank you very much.
No problem.
Yeah, Carers in Bedfordshire is another fantastic service. Carers fatigue is something that's very, very underspoken about, isn't it? And I'm sure there's lots of people in the NHS who are also experiencing carers fatigue, so can really appreciate. So yes, absolutely brilliant service there. Fabulous. So I think we have our final speaker now. We have food is also medicine. I have Diane here from our team. So this is one of our health coaches who I mentioned earlier. Diane, are you there?
I am.
Hello.
I'm just working out how to share my screen now. So I'm not sure how. So I go to share.
Yep, next to leave, you should have a share button.
Mm-hmm.
And then you should be able to choose which of your screens you're sharing.
So that one. I can't do it.
You can't do it? Totally fine. Would you like to start speaking and I'll whip up your slides for you?
Wonderful. So hello everyone, I am Diane Cottrill. I am one of 2 health and wellbeing coaches with the PCN. And if you haven't met one of us yet, a health and wellbeing coach is someone who helps you make wellbeing changes in your life if you feel that you need a bit of support to do so. So we can offer support to help you improve your diet, your physical activity, your mental well-being. And it's kind of a backup of what the pharmacists and doctors would offer you in terms of medication and also the other services that spoke tonight. We can all work together. So with the health coaches, we are split naturally 2 ways. We have one health coach, which is He is guided mostly by mental health issues. I am guided by nutrition. So we work together. We're talking and eating and moving for mental well-being. And so with tonight's talk, I want to share a little bit about how you can use food as a supplement to medication and talk therapy to support your mental well-being. And like Hippocrates said way back when, let food be your medicine and medicine be your food. Research is showing more and more research over the years is showing that what we eat is intrinsically connected to our mental health. Asia, can I go back to the next slide? Yes. So if you the picture on the screen now, it's a quick graphic that shows if you eat unhealthy food, this could be connected to poor mental health. If you eat better, you can have better mental health. So I just like to talk about a few of the hormones that you can produce by eating the right food that will help support your mental health. So when we eat well, the food is digested by the good bugs or microbiome, or you might hear of gut health or gut bacteria. These bacteria work on the food that we eat and help produce these chemicals that make us feel well. And on the next slide, I'll talk a little bit more about a few of the hormones or chemicals that food can help you produce to help you to be happy. So some of the hormones that help us to feel well and have good mental well-being are serotonin, melatonin, endorphins, oxytocin, and dopamine. So serotonin is one of the hormones that your body will produce naturally through food, and it helps stabilize your mood, so it keeps you from having those lows if you have enough serotonin. Now, sometimes the body doesn't produce enough serotonin, and this is when Asia and the doctors come in, will help you with medication to help lift your serotonin levels to help stabilize your mood. But you can work alongside your GP and your pharmacist with the food that you eat to build up your serotonin levels, which will help you stabilize your mood. So the next hormone I have there is melatonin. Now, melatonin is the hormone that we produce that helps us sleep.
Sorry.
And melatonin and serotonin kind of work together. So the more melatonin you have, the more serotonin you can produce, and the more serotonin you have, the more sleep the better sleep you get. So these are hormones that the body will produce from the food that we eat. Then we come down to endorphins. Endorphins help us to relieve stress and help us to reduce pain naturally. So our bodies has a natural way of pain reduction. So again, with medication, you can have pain medication that will help you reduce pain, but there are things that you can do, foods that you can eat to help your body help itself to reduce pain and to relieve stress. And oxytocin, my favorite chemical or hormone, is the cuddle chemical. So this is the hormone that the body releases when you hug someone or you have a very good relationship with family or siblings, or you get from your pet when you stroke your pet. And the very interesting about oxytocin is that you can store it. So you don't just release it and get some for that day. The more you can bank your oxytocin for a day when you may not have your family with you, or you may be separated from your pet, or you may be separated from your social circle. So oxytocin is the cuddle chemical, but it's also bankable as something that you can store up for days when you think you might need it most. And then the last hormone or chemical that the body produces naturally is dopamine. And this one helps us to feel joy and helps us to be motivated to do something. So it's kind of, again, like serotonin, melatonin. The more you do the thing, the more dopamine you get. The more dopamine you get, the more you want to do the thing. So on the next slide, I'll talk about the food or things that you can do to help you produce those chemicals or hormones. So the first one I mentioned earlier was serotonin. So when we eat turkey or chicken or have dairy products or eat fish like tuna, peanuts, nuts and seeds, fruit, the body will then those food will be broken down by our bacteria in our bodies, and from there we produce serotonin. So we can help boost that medication that we're on or the talk therapy that we're doing to increase our serotonin simply by what we put on the plate. Melatonin is similar. You can get melatonin when you eat fish, eggs, nuts and seeds, and grains. These are foods that will help you boost your melatonin, will help you sleep better, which will help you produce more serotonin, like I mentioned earlier. Endorphins we get when we eat dark chocolate. Now, I know a lot of people will hear the word chocolate, but I must stress it has to be dark chocolate, so 70% cocoa or above, spicy food, but also exercise will help you produce endorphins. And these are all, again, things that you can do to support your pharmacist and your doctor medication that you get to help improve your mental health as you go along with your therapy or your treatment. And dopamine, again, we get dopamine from food that we eat. So we eat plant and animal protein. I know we think protein, we think meat, but not so much of the red meat, because red meat has its own issues if we eat too much of it. So we want to maintain our physical health as well. We don't want to just work on our mental health and then we eat too much of something and we create another problem somewhere else. So when we say plant and animal protein, we mean lean protein, white meat, more often than red meat. Red meat is fine, but not as often as you would eat white meat like chicken or fish. So your oily fish like your salmon, your mackerels are good for dopamine, and foods that have natural bacteria that will support your own gut bacteria. So I'm talking like natural yogurt, pickles like sauerkraut, kimchi, soured milk. So in Europe, the Danish, they drink a lot of soured milk. In this country, we use a lot of natural yogurt for cooking in some cultures. So for example, like Greek cultures or Asian cultures, we use lots of natural yogurt. These are all natural places that you'll find good gut bacteria. You can also get good bacteria from aged cheese like cheddar. So you can get good bacteria from beer, not too much mind, and there is the alcohol-free version. But anything that's fermented, something that's left to ferment over days, weeks, months, will produce natural bacteria that will help us work on the food that we eat to produce the chemicals that we need for mental well-being. And beans, we can eat beans as well to help produce more dopamine. So basically increase your plants, more plants, and you can improve your mental well-being. And I mentioned oxytocin, which is the cuddle chemical, but there are other ways you can get it. So if it's not possible to cuddle a person or a pet, you can try yoga, you can listen to some music, giving someone a massage helps, but it's not just the person getting the massage that will get oxytocin, the person giving the massage also gets oxytocin, so that it works. It's where the old adage comes in, there is more joy in giving than there is in receiving. This is a perfect example of, so if you have a partner who likes to have a foot rub, you rub their foot, you get oxytocin, they get oxytocin. It helps with your mental well-being. I've mentioned before, hugging someone you love or a pet, cooking and eating with people you enjoy their company. These are all simple ways that you can improve your oxytocin alongside the diet. And dopamine doesn't just come from food. You can get dopamine when you go outside, you exercise, you sleep well. And one of the things is achieving, when you achieve something, you feel, you get a dopamine high. So it's important that you do something that is achievable, something that is easy to do. So for example, in the new year, we all set goals that we're going to join a gym, and we go to the gym and we want to do an hour and a half because we want to work off the Christmas eating, but that will not give you dopamine. But if you decided, I will do 10 minutes outside 3 times a week, when you complete that small goal, you will produce dopamine. And because you are producing dopamine, you will want to do a little bit more. So you'll find yourself doing 15 minutes 3 times a week. Then you'll find yourself doing 20 minutes. And that's how dopamine works. So little and often will build to more and regular. So when you set goals to achieve your dopamine high, set a small achievable goal that you know you can do, and you will get dopamine. So the slides that we're going to send has information about more reading that if anyone's interested that they can do to learn more about how food and gut connects to the brain, and it's called the gut-brain axis. So it goes from the mouth to the gut to the brain, and it's circular. And thank you.
Amazing. Thank you so much, Diane. Sorry, I guess I had an old version of your slides. We'll make sure we get the up-to-date ones circulated for you.
Yeah, that one will have the references at the end. Yeah.
Fabulous. I think Diane is a classic example of how we work together as a team within the PCN. Quite often I'll speak to a patient and I'll refer them to Diane for some support in like their diet or exercise, and then they will come back to me if we need to look at their medication again, and you can see how we work together. And like Diane said, a lot of those chemicals and things that she was talking about, our medications work on, so it makes sense to tackle it from two angles there. So yeah, hopefully this evening you've gathered some information of some services that you perhaps weren't aware were there. That's why we're trying to hold more of these events, and that's why we're trying to fine-tune them so we can do them a bit more regularly. And we can of course reach so many more people through a screen than we can in a face-to-face event. So any feedback is appreciated. And on the subject of which, I'm just going to share my final slide here. It's just got the QR code for a feedback questionnaire. Like I said to you before, please leave your email on there if you would like a copy of the contact details for the speakers that have spoken today and the slides that you have seen today. We will make sure that you get them. If you wanted to talk more specifically, feel free to book an appointment with one of our pharmacists or our pharmacy team, or get in contact with the service that you are particularly interested in. And of course, we've got our care coordinator email address floating around in that Q&A as well. So if you felt like you weren't sure where to go, a care coordinator is a fantastic place to start. So feel free to pop in any other questions, any other feedback, like I said. Otherwise, I think that's it from us, unless there's anything anybody else wanted to add. I can see your mouth moving, Diane, but I think you're on mute, love.
No, I was just going to say my contact details because I'm just answering a question in the chat box, but my details can be put on for self-referrals, which I forgot to mention.
Thank you. So yeah, hope you found it all interesting. Yep, QR code is there. I will pop the form in the chat again now.
Asia, are you able to share the slide with everyone's contact details who have spoken today?
Yes, so I was going to do that off the email addresses that people are sending us. I don't think I have a slide with everyone's contact details on them.
We can send that tomorrow. We can get that done and
So
send
if
out
you leave
tomorrow.
us your email, we'll make sure you get all the right information. Thank you for the kind words that you're sharing as well.
Thank you, Asia. Nice to meet you all.
Lovely to meet you all. Thank you so much for all your time. Thank you to all our speakers. Thank you to everybody who's attended. Well done, and thank you to everyone who was working behind the scenes on the chat, putting it all together. Hopefully we can do something again.
Bye.
Fabulous. So I'm going to leave the QR code on until about 20 past, and then we'll probably end the call. So hopefully you've got enough time to fill that form out with your information as well. Okay, thank you, everyone. If anyone is left, we will leave the care coordinator email address and the Google form link for feedback in the chat. Please use it. And hopefully we'll see you at one of our next events. Have a good evening, everyone.